Thank you for having me on. So my name is Andriana Sethre. I'm a registered nurse case manager with a home health program in Grand Forks, North Dakota. Um, During this pandemic, I've been working as a case manager for our program, and we like to consider ourselves a pretty self-sufficient group. Um,
Yep.
we are very good at planning ahead. We have things like weather, flooding, different things like that that we work to make sure our staff and patients are safe. But with COVID-19, this was not something that we were prepared for at all, even as a health system. Never could we have imagined sending out our staff to homes with limited PPE. Never could we have imagined asking our staff to reuse disposable masks that are only good for an hour under the best of conditions. Um, in a country that likes to pride itself on its ingenuity and the amount of resources that we have, we were grossly underprepared for a situation that we were warned about that was going to happen. It's my expectation that going forward, some of these funds are going to be allocated to helping prepare our health systems for a potential second round of COVID-19, as well as for supplies and our human capital, which was also hit very hard due to the financial implications of the pandemic. Our health system, like so many others throughout the state, saw layoffs of staff that we'd never expect to see go during a global health pandemic. These layoffs not only affected our program, but talking with some of the people who were let go, I can see how the impact is definitely going to affect our community as a whole. One coworker that I talked to in particular about the type of degree that they hold said they weren't going to be able to find another job in Grand Forks, so they were going to have to look elsewhere. These types of situations, I can only imagine, aren't isolated encounters. When this happens again and again, where employees lose their jobs and have hours cut, our economy is surely going to feel those impacts. This crisis has shown how truly flawed our health system is. Funding should be allocated also to health systems to help improve their functionality, especially in cases of turmoil, and to ensure that other jobs won't be lost during another round. This could include development of more remote care services such as telehealth visit capabilities, which would ensure patients get to see their providers and reduce the spread of further COVID. While I understand these issues surrounding the state, there's North Dakotans who are in need of basic items like food, shelter, and clothing, which I agree really need to come first. I do want to make it clear that in the coming months, we might be faced with even a harder economic impact and hits to the healthcare system that need to be handled, as well as some of the others. So